GERD, another name is gastroesophageal reflux disease. Now, let's take the time and dive deeper into this conversation. What really is GERD? I need you to understand that GERD is a chronic condition where your stomach content repeatedly flows backwards into our esophagus, causing irritation and inflammation. So, this happens because the lower esophageal sphincter, that is the LES, that is a muscular valve between the esophagus and the stomach. Now, this fails to stay closely tight when it should. So normally the LES opens, it lets food in and then it shut firmly. Now in GERD, it becomes weak, relaxed, and poorly coordinated, allowing acid and digestive enzymes to move upwards. So in this case, the stomach is leaking acid upwards into a place that is not built to handle. So if that's the case, then why does the esophagus get damaged then? The stomach has a protective mucus lining designed to tolerate acid with a pH as low as 1 to 2. The esophagus does not. So when acid repeatedly touches the esophagus lining, the cells over there become inflamed. The microscopic injuries also start forming. Over time, erosions and ulcer may develop. Now, this explains why GERD is just not discomfort, it is tissue injury over time. So let's talk about the main causes, the main risk factors, or the main pathophysiology behind it. GERD is usually multifactorial, not just one cause. LES dysfunction mostly is the main problem. Also, we have something called the hiatal hernia. That is a part of the stomach sliding upwards, weakening the LES pressure. We also have the delayed gastric emptying. That is the stomach staying full for longer hours. We also have the intra-abdominal pressure increment. That is obesity, the pregnancy, the tight clothing, certain food substances like fatty meals, chocolate, caffeine, alcohol, nicotine, medications that relax the LES, the anticholinergics, the calcium channel blockers, the nitrates. These all contribute to GERD, I promise you. Now, anything that loosens the valve, overfills the stomach, or pushes acid upwards worsen GERD. Please get that understanding right now. We have the classic versus the silent symptoms. Typical symptoms of GERD are what? Burning chest pain, that is a heartburn, acid regurgitation, sore or bitter taste, chest pressure after meals. We also have the atypical or the silent GERD symptoms. That is the chronic cough, the hoarseness or the voice changes, the throat clearing, the feeling like the asthma-like symptoms, dental erosion. Now, this is why GERD is sometimes mistaken for heart or lung disease. So why does GERD mimic a heart attack then? The esophagus and the heart, they share a similar valve pathways. So our brain may interpret the esophageal pain as a cardiac pain. It is very important. Now, GERD pain often worsens after meals or when you are laying down. Now, cardiac pain often worsens with exertion. Clinically, chest pain is never assumed to be GERD until cardiac causes are ruled out. Now, long-term complications of GERD is a very severe conversation. Untreated GERD, it can lead to erosive esophagitis. It can lead to strictures, that is the narrowing from your scar tissue. It can lead to something called the Barrett esophagus, that is the normal cells changing into intestinal type cells. It can also lead to esophageal adenocarcinoma, that is rare, but it is very serious. So GERD is a chronic inflammatory disease, not just acid reflux. Now we have to talk about the treatment then. It is very important. Lifestyle management is the base foundation. That is weight loss if you are overweight. Smaller frequent meals is very important. Avoiding 2 to 3 hours meals before you lay down. Elevating the head of the bed. Avoiding known trigger foods. What also is the medication for treatment then? Antacids. These are quick symptom reliefs. They neutralize the acids. H2 blockers, that is a famotidine, they reduce acid production. We also have the PPIs, the proton pump inhibitors, that is omeprazole, the pantoprazole. These are strongest acid suppressions. They allow healings. Now, PPIs do not start reflux. They reduce the damage caused by refluxed acid. Pay attention. GERD is not caused by too much acid alone. It is caused by the acid in the wrong place at the wrong time. Now, GERD is a chronic failure of the lower esophageal sphincter that allows stomach acid to injure our esophagus, leading to symptoms like inflammation, long-term complications if they are not treated. I know so many people that have this experience. Please take this time. Please send it to them. Let's educate each other. I always want you to understand that I'm willing to learn from you too. My name is Nerd Solomon, and I'll see you soon.